Welcome to Adapting Class. GI disorders shows up again and again and again on the NCLEX because they are part of the pillars of the NCLEX. Are you ready to tackle very high yield NCLEX review questions on the GI disorders? Stick around. Let me show you content-based practice question you will never forget. It will help you master your NCLEX, whether you are in the nursing school or you're preparing for the NCLEX. So let's get to it. As usual, straightforward. First question, prioritization 101. You have to master it. You have to be comfortable. You should be able to see it. And you said, you step back and said, I got this. Prioritization 101. You have to be sharp. If you have 1 second, which patient will you want to see? But what did I do? I make it select or apply. That means you can compare, look at each question separately, and think about whether that patient needs your second. That's all. How do you read it? Go for the key things, what is happening, not the initial problem, not the initial diagnosis. So, a nurse is caring for the following clients on medical surgical unit. Which client should the nurse assess first, right? This is a select or apply. So you can compare, but take each individual case as a unit. Cirrhosis, who report slur speech. Should the nurse worry about this patient? Does a patient who has cirrhosis have a slur speech? No, it's an unexpected finding. Therefore, you have to intervene. Ulcerative colitis, who report what? Who have bloody bowel movement, right? But then dizziness. Should you worry about it? Peptic ulcer disease, who report what? Epigastric pain that is relieved by what? Food. You've divided the question into two, and you look at the first term and you see what is happening. You ask yourself, and so what? 4, 24-hour post-colectomy, and so what? Who report what? Low-grade fever. You have to be sharp. Diverticulitis, and so what? With rigid abdomen, right? You have to be sharp. Gastroenteritis, requesting what? Antiemetic. Should you worry about it? If you have 1 second, which one of these patients you want to see? Like I said, it's a select or apply, so you can compare, but take each individual and ask yourself, if I have a second and this patient is complaining about this, I have to be sharp or unexpected, right? Gastroenteritis, right? Requesting what? Antiemetic. Well, you have nausea, you have no infection. It's just basically GI problem that probably you have some viral problem. You're not going to die from it. I'm going to give you nausea. I'm not going to see you. You don't need anything from me. So we don't need to see you. You have diverticulitis, you have inflammation, you have infection. What is happening? Rigid abdomen. This is sepsis, peritonitis. We got to see them. That's one of the bishop words you have to be familiar with. 24-hour post-colectomy. After you have surgery for surgery, hey, 1 day after surgery, you're going to have some fever. Don't worry about it. Peptic ulcer disease. You have epigastric pain. That is what will happen if you have peptic ulcer disease. And this goes away when you eat food. Don't worry about it. Ulcerative colitis, you're going to have bloody bowel movement. But guess what? Now the patient is dizzy. This is not an expected finding. This is a problem. Cirrhosis patient will develop ascites, will develop slur speech when they have what? Encephalopathy. So slur speech is a form of encephalopathy. Therefore, 1, we got to see. 2, we have to see. And 5, we have to see. If you need help with prioritization, check Adapting Class where you can master this sharp, and it will help you think critically. And don't worry about any other method. Just think about it. If you have 1 second, what would you do with this patient? Are you going to run away from this? I know you watched the other video. You shouldn't run away from this. This is just something you know. I put it in the table. This is NGN question, standalone. Don't run away from it. Just tackle it head on. Which next actions are appropriate? That means these actions are appropriate. Select or apply. You have to choose something at each column and row, right? A client present with what? Weakness, buzzword, black tarry stool, bleeding, and dizziness, right? His blood pressure 90/60, heart rate 110, respiratory rate 24, temperature normal. What would you do? Weakness, black tarry stool, and dizziness. Then hypotension, tachycardia, all consistent with what? Shock. This patient is bleeding and is in shock. What would you do? Don't overthink it. Don't make it so hard. It's a GI problem. If it's a GI problem, there's simple things you can do. He's already vomiting and he's having what the patient is already in shock. The least thing you can do is to make them NPO. Protect their airway. If you NPO, you will need some fluid. That's all. And if you have pain, we give you pain medication. If you have nausea, you get antiemetic. If you're bleeding, you get blood. Don't make GI pathology difficult. Well, patient is dizzy, hypotensive, tachycardia, is in shock. We're going to give him IV fluid. Patient is dizzy, black tarry stool, I will prepare for blood transfusion. Patient is dizzy, black tarry stool, tachycardia, hypotensive, I'm not going to lift your head up. You lay supine with your leg up. Your leg should be up or your knee flexed to help with your blood pressure. Not appropriate. Encourage PO intake to promote hydration. Somebody will pick this answer. Once again, somebody will pick this answer because they see hydration. But go back to the content, test-taking strategy. Look at the content and said, I'm in shock. Do you want this patient to be drinking? Negative. Insert NG tube for oral medication. This is another trap. Patient is having GI bleed. Even if we have to insert NG tube for gastric lavage, this is usually done by the provider, not the nurse. We don't need to give you PO medication for the reason of inserting NG tube. Negative. Monitor mental status because I'm dizzy, because I'm bleeding, and because I'm in shock. Rational. Questions and answers. Rational. Prepare for administration of octreotide. You have to know a little bit of content. It's a GI bleed. If you're bleeding, I can prevent blood flow to the GI tract. One of the medication we use for GI bleed is what? Octreotide. So this is what we can give. Straightforward, content-based. This is the way they've been asking the question. You know it in the table form. Don't run away from it. I know you watch that NCLEX. You got this. Third question, GI, NCLEX review question, NCLEX practice question, GI disorder. Straightforward test-taking strategy, right? And next is assessing a client with suspected cholecystitis. Which findings should the nurse report immediately? How do you answer questions? Read it from the back. Report immediately. I know I have to be sharp. Be sharp. And then go for the buzzword. And then is assessing a client with what? Suspected cholecystitis. You have anheitis, inflammation. And if this is your body, gallbladder is in the right upper quadrant. You have right upper quadrant itis, cholecystitis. Which finding should the nurse report immediately? That means you can have expected finding associated with cholecystitis that you don't have to worry about it. What is that? Right upper quadrant pain after eating. That is the definition of cholecystitis. Don't pick it. Positive Murphy sign. That is the definition of right upper quadrant. When you push there, and this is the same thing. 1 and 2 saying the same thing. Right upper quadrant pain with inspiration and rest is Murphy sign. Yellow thing sclera, that means you join this. If you have right upper quadrant pain and you have joined this, that's a problem. It's not part of the classic symptoms associated with that. If you have inflammation, you're going to have nausea. If you have nausea, you may vomit. 4 is expected. 3, 2 is expected, and 1 is expected. Yellow skin is not what we expect. Therefore, this is a complication. We have biliary obstruction, and that is a problem. I got to pick number 3. Another table from standalone, trying to help you get your guardrails steady. And then when you see this question, you step back, you said, adaptant class already trained me. A 45-year-old client is admitted with severe epigastric pain. Buzzword, epigastric pain, right in the middle. Where does it go? Back, radiate to the back. What is happening? Nausea, vomiting, lipase elevated, amylase elevated. I've given you, this is like a case study. Instead of giving you a full case study, I just summarized the buzzwords. Patient has epigastric pain that goes towards the back. Now he has nausea, vomiting, and what? Elevated lipase and amylase. What do you think? Make a diagnosis. When you combine all these buzzwords, you know that this is what? Acute pancreatitis. It's a GI problem. Every GI problem, you got to make them MPO. You got to give them IV fluid. You got to give them antiemetic if they need it. You got to give them pain medication. These are the most common things. If they need fluid, if they need blood, you give them blood. If they need NG tube, you give them NG tube. But not everybody need it. Therefore, pancreatitis, what do? Keep the client MPO. Of course, he has nausea and vomiting, MPO. Place client in the semifilar position. That is the position that will open the back, the retroperitoneum, their back open so that it can help with the pain. Like in the fetal position. Prepare to give IV or dancetrol. The patient has what? Nausea, vomiting. You don't want to give it anything to their mouth. So IV form is better. Monitor respiratory status. These patients usually need too much fluid and the priority function is a respiratory problem. Therefore, monitor that. Prepare to administer antibiotic. This is not a form of infection. It's an inflammation. It's different from appendicitis and cholecystitis or diverticulitis. Those need antibiotic because they are infection. This one is inflammation, no antibiotic. Administer enema as prescribed. If you put anything in their rectum, they may perforate because they may have ileus. They don't need enema. Apply antihistamine cream to periumbilical bruising. If you see periumbilical bruising around here or around the flank area, these are bleeding. It's emergency. They are prioritization. This is curling a great tenor sign. You should not apply antihistamine cream there. You should call the doctor. Not appropriate. Test-taking strategy, content-based, NCLEX review questions, adapt NCLEX. The client who follow a lacto-ovo vegetarian diet is selecting lunch. Which meal should choice is appropriate? This is straightforward. When you see this kind of question, don't run away from it. Go for the buzzwords. This lacto-ovo vegetarian with meal choice is better. Then sit back and then underline it. Vegetarian, no meat, right? Therefore, I'm not picking any meat problem. But what kind of vegetarian? It's not a pure vegetarian, lacto. That means I can eat milk. Ovo, that means I can eat egg. Therefore, a vegetarian who can eat egg and milk, but most of the rest is all vegetarian diet. Grilled chicken is a meat, negative. Tofu stir fry with vegetables and glass of milk. I don't see any meat there. I see a milk here, lacto, that's good. And the veggie is good. Egg salad sandwich, bacon, no, negative. Tuna salad, negative, even though I have egg here. This is the way you answer this question. Therefore, number 2 is the best answer. You just have to break down the initial problem and you'll be able to figure it out. The client with hepatitis B asks how the infection spread. What is the correct response by the nurse? It's contact-based. Hep B means body fluid. That's all. Body fluid. Pick an answer choice that say body fluid. You can catch it through sharing eating utensils. Utensils is not body fluid. It is spread through contaminated water. Water is not body fluid. It is transmitted through blood and what? Body fluid, BB. It only spreads through sexual contact. Sexual contact is body fluid, but the only information there changes. Therefore, I'll pick 3. 3 is always a good one if there's no absolute information as only information. And this is assessing an infant who has been vomiting for 3 days and is diagnosed with pyloric stenosis. Which of the following findings should the nurse suspect? Select or apply. Let's go back, apply it, test taking strategy. I like to give you a bunch of select or apply so that you become comfortable when you watch my video. When you go take the test, you see them, you say, I'm not panicking. Pick those you're confident. There's 6 questions there, answers there. If you only know one, pick it and move on. Otherwise, you will get 0. Select or apply. I know I got to pick something here, 6. I don't know if all the 6 are right. Then maybe there's 4 there. If I pick 2, I get 2 out of 4. If I pick 6, I get what? You lose all the points. You're left with 2, right? So make sure if you pick all the 6, you get 0 basically. So make sure you don't overpick. And this is assessing infant. He's been vomiting for 3 days. He has pyloric stenosis. If you have pyloric stenosis, all you do is vomit your gastric output, and therefore you become dehydrated for 3 days. Therefore, look for signs of dehydration and signs associated with pyloric stenosis. Olive-shaped mass in the right upper quadrant is called pyloric stenosis. Projectile vomiting after eating is called pyloric stenosis. Sunken fontanelle is called dehydration. When you vomit your acid out, and therefore you'll be left with alkaline. You become alkalosis. No. When you lose all your fluid, you lose weight. If you lose weight and you lose all your fluid, your urine becomes dark. You see how I take the content, I use it to answer the question and break it down. Olive-shaped mass, expected projectile vomiting, expected sunken fontanelle, dehydration. You get metabolic alkalosis, you have weight loss and dark pungent urine. The nurse is preparing to administer an enema to a client. Which action should the nurse take first to ensure client safety? I've given you enough information that this is the key. Safety first. Enema. Don't get trapped about something that is reasonable. Think about the best thing. Warm enema solution to the body temperature. Position the client in the left lateral sim position. Assess the client for history of rectal surgery. Instruct the client to retain the enema for 50 minutes. They all sound good. They all sound normal. They all sound fine. But look, prioritization is you don't have time. You have 1 second. You don't want to cause injury to the patient. Fine, we're going to warm the solution. Fine, I'm going to place the client in the left lateral position. Fine, I'll make sure the enema stay there 15 minutes, but I got to make sure they have not had anything that will prevent me from putting the enema there. Contraindication of placement of enema is rectal surgery. So if there's not anything in their rectum that will prevent me from putting the enema there, it's the most prioritized information. Therefore, number 3 is the best answer. And this is teaching a client prescribe metronidazole for what? GI infection. Which statement by the client indicate a need for further teaching? This is a pharmacology you need to know. It's metronidazole. We use it all the time. It's a common prescription. We use it for C. diff. We use it for vaginosis. We use it for trach, everything, right? But you cannot drink with it. If you drink, you get disulfiram reaction. It has metallic taste. Okay, so you have to be careful. It's a sulfur drug too. So be careful about some things. I will avoid drinking alcohol while taking this medication. Good idea. I will experience a metallic taste in my mouth. Expected. It's safe for it's safe to take this medication with alcohol in small amounts. You can see 1 in 3 is saying something different. One is fully on board, and 3 is not fully on board. That tells you 1 on 3 may be the right answer. I should complete the full course of the medication because it's an antibiotic. It's not safe to take it with even small amount is bad. So 3 is a wrong answer. And the last one, this is content-based, and it reviews the laboratory results of a client diagnosed with both liver cirrhosis. Which of the following findings should the nurse suspect? Content-based. This is your liver. It makes bile. It's responsible for protein synthesis. When the liver gets injured, it becomes cirrhosis. Anything that is injured, it cannot make things that it makes. Therefore, if it cannot make protein, your protein albumin should go down. It tries to get rid of your bilirubin. If it cannot get rid of your bilirubin, bilirubin goes up. Right? If you get injured, AST, ALT, which is the liver function test, or increase. It makes proteins. If you can't make proteins, your INR is controlled by the proteins. Therefore, this goes up. The TRAPI answer is this. PTT is not related to the liver. It's PT. Therefore, elevate INR. Your platelet is supposed to go down because of the effect on the spleen. The spleen chew it up, and the spleen will have, you have a bigger spleen and you chew your platelet. So this goes down, bilirubin goes up, albumin goes down, AST go up, ALT go up. So 1, 2, 4, 6 are your right answer. Thank you for watching. Thank you for your time. If you like this video, share with your friends, subscribe, and get more content like that. You can join our incoming crash course for your content. If you're preparing, you don't have enough time, in a short time, you want to learn everything in a short time, 10 days, 11 days, come to Adapt NCLEX to give you content. Thank you for watching, and good luck.